So after these very good presentations before, and now I have the pleasure to introduce this aspect, which is prevention, treatment, counseling for addiction disorders. As Maris said, for all these services which are offered by the Health Insurance Fund, so to legal drugs, as you can see that they're most common in Estonia, tobacco, this is nicotine and alcohol. So for these two services which we offer, then there were years of work was done before that, where the evidence-based practice has been collected from across the world. And maybe good optimal solution has been found for Estonia, where we have used pilot project with the health service providers. And we got feedback, we had follow-up, developed, added something. So today, in the list of healthcare services, as of 1st of July 22, so giving up tobacco and nicotine, so mostly counseling. And as of this year in January, we also have services for people troubled by alcohol use, so both abuse and addiction. So our objective is to assure that these services will be accessible in all three levels mentioned on this page. So primary level healthcare, we cannot avoid the importance of primary level when it comes to early detection, brief intervention. So on the primary healthcare level, it's usually tobacco and nicotine and alcohol abuse. So this is early detection and brief intervention. Now the school healthcare. So this is very good because the previous panel discussion where we talked about young people at school, then I was thinking about it and I found that we are really on the right path because in the level of school healthcare, so in education institution, we have to be able to assure advisory services. So that's in general education, basic education, vocational education, gymnasium. So here the early detection and intervention role came out from this discussion as well. This role is for everybody, all the teachers, all the specialists. So what is the next step? So is the next step with the police or district police? Or should we try to solve the situation if the young person has been caught with the drug, then shall we just handle it on a case-by-case basis at school? So when we talk to schools, then the specialist mentioned that alcohol is for weekends for young people, and during the school day there might be tobacco and nicotine products. So once we mentioned the parents, then on the school healthcare level, this service provision, since it's one of the offered services, that means that the school nurse does counseling, then it will be covered by the digital medical history, and the access is there for the parent as well. So before advisory services, you have to ask the parents' permission. And this is perhaps where the school team can talk to the parent, inform the parent that the child was caught vaping, for example. So what are now the next steps? First should be the school nurse is providing advice to the child and for the family, and then we look at the specialized medical health care. So it's usually nicotine and tobacco services, pharmacological support. and treatment services for alcohol abuse. So before I get into details of the services, I would like to mention some of the most important points. So what is important to know for these services? So all these services, both for tobacco and nicotine services and alcohol abuse, all these services are provided to all the patients without a fee, and these services are available free of charge to everybody, for people who have health insurance and who don't have health insurance. So if you don't have a valid health insurance, it's still you have access to the service. So these services do not presume the existence of a referral. There is a difference here when it comes to the alcohol abuse disorder, where the inpatient treatment presumes referral, but not for other services. And when it comes to specialized medical services, in order to get access to the service, you need to have prior registration, depending on what kind of service provider you have, either national and digital registration, or you have to use the registration phone number to book your time. And when it comes to GP, it's the usual access. And one clarification, so who are the service providers? So there's one condition. So everybody who carries out these interventions, and then these healthcare services have to follow a special drug prevention training provided by the Health Development Institute, because it used to be tobacco and nicotine separately, alcohol separately. Now it's generic drug prevention. And then in addition to that, there is also counseling and motivational interviewing. So a little bit about the services themselves. So if we talk about the primary level healthcare and the abuse of alcohol, prevention and counseling, as I said before, then the GP level plays a very important role to notice and to intervene, and tobacco, nicotine and alcohol are one of the risk factors for chronic diseases, also for different types of cancers. Then the GP is the person who is the first one to intervene, and practices how the Estonian GPs do that, or the family nurses will do that, or any other primary level specialist. So the different practices there. So this is the question for the GP themselves, because there are some who screen all the adult patients on the list on a regular basis, because things happen in life, because there is recession, there is war, things happen. And the person who 2019 was completely sober by year 20 or 2023 could be abusing alcohol or has a problem with nicotine. So there is an audit, a test, which the family nurses and doctors use, and which helps screening how deep is the addiction or this abuse, or there is risky behavior. So the GP can find out what it is the next important activity. So if the use is below the risk level, then you just tell the patient that you've done well and you motivate them to continue the lifestyle. But if there is risk behavior, then if possible and the patient is ready for that, then it'll be important to have this brief intervention. So this is what we know as a brief intervention, or brief counseling, as we call it. So it could be 5 to 10 minutes. But there are some people where we find out that there could be mental health problems or some other concerns. So that means that they need a longer counseling, and we have included a wider counseling, so where we are talking about mental health, exercise, diet, everything else which can have an impact on lifestyle. So when it comes to tobacco and nicotine products, then it's the same journey. So the patient is at the reception, and during the doctor's visit, the doctor and the nurse notices that their habits are endangering their health or not supporting health. Then it's the same way. So there will be a test for addiction of nicotine, followed by counseling, and both for alcohol and tobacco. There are some brief interventions which should become very important. So here it's very important to note what was also said by our keynote speaker, to develop e-services. All these services are accessible over the video or over distance. So although the doctors prefer to meet with people face to face, but if necessary, then the first visit can be done remotely to make sure that the service is accessible to everybody who needs it. Now, if you will go into the specialized healthcare, so this is where the patient or the GP finds that the interventions offered by them are not sufficient, and they can't help this patient because there's no referral for the specialized treatment. Then what can be done? First is to approach a treatment facility, a clinic of a hospital. There are 11 in Estonia offering these services, and there it works the same way. So preliminary reception, the visit with a psychology or mental health nurse, assess the situation of the patient. If necessary, an audit is organized. Maybe a test for emotional situation to understand where this patient is at the moment. And this will be followed by an individual plan which will be developed for the patient. And the best intervention is then chosen. There could be laboratory testing done later, some supporting therapies, other treatments, social worker. So these are 3 levels. So there is outpatient, day surgery, or inpatient. So these are services which are also available as a long-distance treatment as well. When it comes to tobacco and nicotine products, there are 15 clinics which are offering this kind of specialized treatment, where the ambulatory treatment means that there is a preliminary assessment carried out, and then counseling later, and if necessary, so there are medications prescribed. So how have we managed? So this is a week ago. So this morning, before I started driving towards Tallinn, I took Power PI. So this is one of my favorite tools. When we started with this service, this was my every morning I opened it and I looked at the numbers of service providers and people receiving services. First of all, it's very important that the people have the training. In Estonia, we have had very long-term training for alcohol since 2016. And the Health Development Institute has trained over 1,200 people, over 300 GPs, and over 500 family nurses, and over 400 different healthcare workers. This year, over 100 has been added. So we have a whole list of GPs who've been trained. So this is quite an impressive figure, but there's a long way to go. And when we started in January, So first of all, we had 11 service providers and then 22. By the end of January, 44. So now we have 123 different service providers, and 104 of them across Estonia are different GPs, health centers, so they are the ones offering these services. And counted at the right now, we have active GPs who are providing services. There's about 160 and about 200 family and nurses. So the number of people, so here we have 6,200. This morning was 6,424. So usually there is extra 100 people popping up who received services. This is the total. So tobacco and nicotine, and also alcohol abuse. Now when it comes to challenges and the future, so what it is what we can look forward to. Priority number 1 is the expansion of the number of service providers, so that this service will be accessible for everybody across Estonia. We need to make sure that the family doctors, family nurses, other healthcare providers would be available who can carry out this brief intervention. So our dream is that in 5 years' time, all the GPs and family nurses will have the skills. So if there's a person who needs some help, then they can do this brief intervention. So this is a nice dream. And maybe if we're making an effort with the Health Development Institute, then maybe this is how we get. So when it comes to the service providers, then we can increase the numbers by including the private service providers as well. So for that purpose, we have twice a year we can apply for additional support with the precondition that the people who will be working with patients has received the training. And maybe the concern here is about health centers or GP centers where they have more nurses or more doctors together and they can have an extra nurse, then it's easier. But if you have a single physician practice, as our keynote speaker, Professor Babo, said that there's not enough time, and this is what we hear from the family doctors and nurses as well. They just don't have time for counseling because they just are overburdened. Now, specialized medical treatment for tobacco and nicotine. What we're thinking about is that dentists, for example, because they are the ones who notice what is going on. So maybe they are the people who could do the intervention first, who can provide nudging towards positive change. And then pharmacists, they can also offer counseling for tobacco and nicotine. What is important is the quality and accessibility, especially for remote services, that the remote services are developed so you can receive patients over video. Then constant training for service providers. As I said, the Institute has contributed a great deal and they're continuing this work. We can invite healthcare workers to participate and they can learn. And no less important, we have the awareness of this service being available. So first of all, they are not patients, but they are people who are using tobacco and nicotine products. Maybe they abuse alcohol. They don't even know that this kind of services exist. Because every day I get letters and calls where people ask for assistance. They want to know where to go. On our website for the Estonian Health Insurance Fund, there is a whole list of services for addiction disorders. So which are the GPs offering the services? So there are contacts and numbers all available. Now, stigma is also something which is mentioned. So a reduction of stigma, because these people themselves, they stigmatize themselves when they have problems with drugs. And healthcare providers sometimes stigmatize these people themselves. They are being seen as people who cannot be helped, and there's no point of wasting time. So this is a stigma which has to be broken. And when it comes to design of new services, so maybe we get some new ideas. And maybe there are things we have not been able to think about yet. So what are the possibilities and capabilities which you can offer for the people who need help? To conclude, this is a well-known African proverb: if you want to go fast, go alone, but if you want to get far, then you go together with others. When it comes to the field of drugs, then we can't do anything alone, because we can move very quickly and think we're so fast, and then we find that we've actually gone the wrong direction. So only together we can change something, and together we'll get far. Thank you.
Aitäh, et lõpetasid selle vanasõnaga. Mina olen kasutanud seda läbi aastate ka.
This is a proverb I have also used throughout the years, and in English.
If you want to go far, go together. Aga ma ei lase sind veel päris minema.
But several questions have been submitted. You showed this Power BI graphics, infographics. Is it open source? You can use it if you're